Emergency department overcrowding, or ED overcrowding, is happening across the United States. It isn't a new problem, but we aren't seeing any measurable improvements, and the COVID-19 pandemic has only served to magnify the issue. Input, throughput, and output to the ED are all factors that ultimately affect the patient flow and capacity that an ED can handle. You see, the emergency department is like a clogged kitchen sink at home. The sink isn't typically the main problem. The clogged pipes that carry the water away are likely the culprit. Something isn't allowing the appropriate flow needed to keep the sink clear. Just as water flows into a sink, the ED sees patients flowing in, patients with medical or surgical emergencies, non-emergency cases, ambulance arrivals, patients with limited access to care. That's the input. Then you've got what's happening in the sink, or the ED. Degree and acuity of medical and surgical cases, length of time to see the patient, process of triage and bed placement, length of time to receive tests, consults, and other ancillary services, boarding, or the time spent waiting for the next step in care, staffing shortages at all levels, lack of 24/7 availability to critical diagnostic services, that's the throughput. And finally, the water needs to leave the sink just as patients cannot remain in the ED after their acute need is addressed. Patients need hospital beds with nursing staff available. Patients need to be transferred to mental health, nursing homes, and other facilities. Patients need sufficient care in the home to be safely discharged. The ED is open 24 hours a day. Patients need transported without lengthy delays. Timely follow-up to primary care providers, that's the output. As you can see, the size and breadth of the factors contributing to ED overcrowding affect every piece of healthcare in our state. Together with our healthcare community partners and legislators, we can begin to address this big problem that puts our citizens in danger. If you've been affected by ED overcrowding or ED overcrowding is important to you, please visit www.pamedsoc.org/ED overcrowding.